This is the Coronavirus Morning Report for Monday, April 27th, 2020. I'm Jackson Bird. The lockdowns are starting to come down in New Zealand and even Italy. New official symptoms of the disease from the CDC. A follow-up on that story about stroke victims suddenly appearing. Parsing the headlines about immunity or lack thereof. A rule of thumb for assessing true infection numbers. And how to save summer 2020. I suppose we should start this week with a straight numbers roundup. Sometime in the next few days, global infection numbers will surpass 3 million, and confirmed cases in the U.S. will pass 1 million. Global deaths have already passed 200,000, and U.S. deaths stand at 54,000. British Prime Minister Boris Johnson has returned to work after more than 3 weeks out battling coronavirus infection, which is a timely reminder of all the ways that this is not the normal flu. Recovery times, if you get it, and even if you get a mild case, which Mr. Johnson did not, is often measured in weeks, not days. New Zealand is preparing to lift its lockdown restrictions as the virus has been effectively eliminated in that country. While new cases are still being diagnosed, authorities know where each of them is coming from, the country's Director General of Health, Ashley Bloomfield, said at a Monday news conference. For 8 days in a row, the number of new cases has been in the single digits, and only 19 deaths have been reported in a country of 5 million. Italy says it will lift what is the West's longest coronavirus lockdown for the first time next week, quoting Reuters. Manufacturers, construction companies, and some wholesalers will be allowed to reopen from May 4th, followed by retailers 2 weeks later, while restaurants and bars will be allowed to reopen fully from the beginning of June, although takeaway business will be possible earlier. And quoting Italian Prime Minister Giuseppe Conte, "With this system, we take upon ourselves the risk of an opening, but with all precautions. We expect a very complex challenge. We will live with the virus, and we will have to adopt every precaution possible." Quoting the Washington Post, "Most federal states across Germany implemented rules on the wearing of face masks in public on Monday amid hopes that it will allow businesses to reopen without sparking a second wave of infections. The details differ between federal states. For instance, in Berlin, face masks are mandatory on public transport, but violating the rule will not be penalized. In Munich and other cities, however, the rules are expected to be more strictly enforced with hefty fines. Face masks are now also mandatory in supermarkets and other shops across much of the country." End quote. And an interesting data point suggesting a hunger for digital tools to keep the virus under control, quoting the Post again, "A coronavirus tracing app released by the Australian government on Sunday has already been downloaded more than 1 million times, despite privacy concerns. Registering with the app, called COVID Safe, is optional but strongly encouraged by health officials who say it will help speed up the contact tracing process and allow people to get diagnosed and treated early. Using Bluetooth technology, the app logs each time that a user comes within 1.5 meters, 4.9 feet, of someone else. When an app user later on tests positive for coronavirus, their log of recent encounters will be accessed, and everyone who has had more than 15 minutes of close contact with them will be notified. The encrypted data recorded by the app will only be made available to health officials when someone tests positive for COVID-19, and the Australian government says that it will be deleted once the pandemic is over. But privacy advocates have asked for more safeguards, including legislation that explicitly states that the data cannot be used by law enforcement. On Sunday night, just hours after the app was unveiled, Australian Health Minister Greg Hunt tweeted that it had been downloaded by 1 million people, representing roughly 4% of the country's population. Prime Minister Scott Morrison said that if enough people sign up for the app, the government will be able to lift some lockdown restrictions. But in order for the app to be maximally effective, at least 40% of the population will have to download it. End quote. The app's design is similar to that used in nearby Singapore. In addition to fever, cough, and shortness of breath, the CDC adds chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell as symptoms of COVID. As Chris Mims at the Wall Street Journal notes, this is important because in many states, you still can't get a test without showing official symptoms. And yesterday, the Boston Globe ran 21 pages of death notices, triple the number of obituaries published on the same Sunday last year. The Star-Ledger in Newark printed 109 obituaries on April 12th compared to 17 on the same Sunday last year. Now, a follow-up to a piece we brought you last Thursday about how coronavirus seems to mess with the body's blood clotting system. COVID-19 seems to make the blood clot in unexpected ways and places in some patients with deadly consequences. Quoting from the Washington Post, Thomas Oxley wasn't even on call the day he received the page to come to Mount Sinai Beth Israel Hospital in Manhattan. There weren't enough doctors to treat all the emergency stroke patients, and he was needed in the operating room. The patient's chart appeared unremarkable at first glance. He took no medications and had no history of chronic conditions. He had been feeling fine, hanging out at home during the lockdown like the rest of the country, when suddenly he had trouble talking and moving the right side of his body. Imaging showed a large blockage on the left side of his head. Oxley gasped when he got to the patient's age and COVID-19 status. 44, positive. The man was among several recent stroke patients in their 30s to 40s who were all infected with the coronavirus. The median age for that type of severe stroke is 74. As Oxley, an interventional neurologist, began the procedure to remove the clot, he observed something he had never seen before. On the monitors, the brain typically shows up as a tangle of black squiggles, like a can of spaghetti, he said, that provide a map of blood vessels. A clot shows up as a blank spot. As he used a needle-like device to pull out the clot, he saw new clots forming in real time around it. Doctors were able to remove the large clot, but the patient remains hospitalized over a month on. Pascal Jabor, a neurosurgeon at Thomas Jefferson, told the Post that COVID-19 appears to be causing extraordinarily strange clotting problems. Quote, brain clots usually appear in the arteries, which carry blood away from the heart. But in COVID-19 patients, he's also seeing them in the veins, which carry blood in the opposite direction and are trickier to treat. Some patients are also developing more than one large clot in their heads, which is highly unusual. We'll be treating a blood vessel and we'll go fine, but then the patient will have a major stroke because of a clot in another part of the brain, he said, end quote. At Mount Sinai, another New York hospital, COVID-19 stroke patients were, on average, 15 years younger than stroke patients who didn't have coronavirus. A particularly distressing part of this problem is that people who are having strokes at home seem to be delaying seeking care out of fear that they'd contract COVID-19 at the hospital. The Mount Sinai team cited 5 cases of people in their 30s and 40s who, quote, were all home when they began to experience sudden symptoms, including slurred speech, confusion, drooping on one side of the face, and a dead feeling in one arm. 1 died, 2 are hospitalized, 1 is in rehab, and 1 was released home to the care of his brother. Only 1 of the victims is able to speak. Quoting again from the Post, Oxley said the most important thing for people to understand is that large strokes are very treatable. Doctors are often able to reopen blocked blood vessels through techniques such as pulling out clots or inserting stents, but it has to be done quickly, ideally within 6 hours, but no longer than 24 hours. The message we are trying to get out is if you have symptoms of stroke, you need to call the ambulance urgently, end quote. You may have seen the headlines. The World Health Organization says there's no evidence you'd be immune to the coronavirus if you contract it and recover from it. The detail behind the headline is more nuanced, though. As Nate Silver of 538 points out on Twitter, what the WHO likely means is that there's no definitive proof yet. Yet being the operative word. Let's start with what the WHO says. The organization's initial tweets on the topic, which have since been taken down, were entirely concerned with warning off countries from issuing so-called immunity passports, because in its view, the science isn't currently there to support such documents, and it worries that people could be lulled into a false sense of security. Quoting directly from the WHO's scientific brief on the matter, some governments have suggested that the detection of antibodies to the SARS-CoV-2, the virus that causes COVID-19, could serve as the basis for an immunity passport or risk-free certificate that would enable individuals to travel or to return to work, assuming that they are protected against reinfection. There is currently no evidence that people who have recovered from COVID-19 and have antibodies are protected from a second infection, end quote. The organization goes on to say, WHO continues to review the evidence on antibody responses to SARS-CoV-2 infection. Most of these studies show that people who have recovered from infection have antibodies to the virus. However, some of these people have very low levels of neutralizing antibodies in their blood, suggesting that cellular immunity may also be critical for recovery. As of 24th April 2020, no study has evaluated whether the presence of antibodies to SARS-CoV-2 confers immunity to subsequent infection by this virus in humans. And one more quote from the WHO, which sums up their current position on immunity certificates. At this point in the pandemic, there is not enough evidence about the effectiveness of antibody-mediated immunity to guarantee the accuracy of an immunity passport or risk-free certificate. People who assume that they are immune to a second infection because they have received a positive test result may ignore public health advice. The use of such certificates may therefore increase the risks of continued transmission." End quote. Importantly, and here's the yet part behind the headline, the WHO said on Saturday, quote, "We expect that most people who are infected with COVID-19 will develop an antibody response that will provide some level of protection. What we don't yet know is the level of protection, or how long it will last. We're working with scientists around the world to better understand the body's response to COVID-19 infection. So far, no studies have answered these important questions." End quote. So what is going on? If you catch coronavirus and recover, are you immune from a subsequent infection? Well, we don't know for sure. Nate Silver puts it best, quote, "The consensus of the evidence, as best as I can tell, is that there's very likely to be some degree of immunity, although we don't know how absolute it is or for how long it confers, and there's still a lot to be learned about it." End quote. So sure, we may be a ways off from issuing immunity certificates, but there's more to it than those headlines saying outright that there's no evidence at all that COVID-19 immunity exists. In a piece for the New York Times, epidemiologist Mark Lipsitch wrote, "After being infected with SARS-CoV-2, most individuals will have an immune response, some better than others. That response, it may be assumed, will offer some protection over the medium term, at least a year, and then its effectiveness might decline." And what about those cases in South Korea where people who tested positive and recovered then tested positive again? Lipsitch says, "South Korea's Centers for Disease Control and Prevention recently reported that 91 patients who had been infected with SARS-CoV-2 and then tested negative for the virus later tested positive again. If some of these cases were indeed reinfections, they would cast doubt on the strength of the immunity the patients had developed. An alternative possibility, which many scientists think is more likely, is that these patients had a false negative test in the middle of an ongoing infection, or that the infection had temporarily subsided and then reemerged." End quote. South Korean health authorities are working to establish what exactly happened with those cases. So right now, we need more science. And that's essentially what the WHO is saying. There's no concrete evidence yet about COVID-19 immunity. The good news? There are many studies underway to understand the antibody response to coronavirus and how much, if any, immunity it provides.
I've been a Stamps.com customer for 20 years. I've founded 3 different startup companies, and every one of them used Stamps.com from day one. Some of those companies were literally built on top of the services Stamps.com allowed me to provide to customers. In the current business environment, you need Stamps.com just to keep your operations running at this point. Anything you can do at the post office, you can do at Stamps.com, and yet you don't actually have to go outside and physically go to the post office. Simply use your computer to print any U.S. postage 24/7 for any letter, any package, any class of mail, anywhere you want to send. And you save money with Stamps.com, something that's especially welcome to any business during these times. 5 cents off every first-class stamp and up to 40% off USPS shipping rates. And now, in addition to offering discounted U.S. Postal Service rates, Stamps.com also offers UPS services with discount rates there up to 62%. Right now, listeners to this show get a special offer that includes a 4-week trial plus free postage and a digital scale, all without any long-term commitments. Just go to Stamps.com, click on the microphone at the top of the homepage, and type in briefing for this special trial. That's Stamps.com, enter briefing. Stay safe, my friends. Beachbody On Demand is the easy-to-use streaming service that gives you instant access to over 1,300 super effective workouts you can do right now in your home. And frankly, there's no better time than right now to start an easy, home-based, on your schedule, easy-to-do with no pricey extra equipment needed workout regime than right now when you're stuck in your home. There are hundreds of effective workouts for all fitness levels, ranging from bodybuilding to weight training to cardio hit to yoga, even dance workouts. Get motivated by celebrity super trainers you know, like Tony Horton, Joel Freeman, Jericho McMatthews, and Autumn Calabrese. You know Beachbody for things like P90X, Insanity, and 21 Day Fix. Now check out some of Beachbody's newest programs like Morning Meltdown 100 and 80 Day Obsession, and start every day strong. Let's get in shape together, everybody. Listeners to this podcast can get a special free trial membership when you text BRIEFING to 303030. You will get full access to the entire platform for free. Again, just text BRIEFING, BRIEFING, to 303030.
There was yet another serology test that was released late last week, this one in Miami-Dade County in Florida, quoting the Miami Herald. About 6% of Miami-Dade's population, about 165,000 residents, have antibodies indicating a past infection by the novel coronavirus, dwarfing the state health department's tally of about 10,600 cases, according to preliminary study results announced by University of Miami researchers on Friday. The study, spurred by Miami-Dade County officials, will be an ongoing weekly survey based on antibody testing, randomly selecting county residents to volunteer pinpricks of their blood to be screened for signs of a past COVID-19 infection, whether they had tested positive for the virus in the past or not. The goal is to measure the extent of infection in the community. Friday's results, based on 2 weeks of countywide antibody testing and about 1,400 participants, found that about half of the people who tested positive for antibodies reported no symptoms in the 14 to 17 days before being tested. If the trend holds, the findings could have major implications for understanding not only the number of people infected, but also how many have symptoms, and in return, how the virus spreads. End quote. Yes, we now have several antibody test results, the 2 from California and the 1 from New York, and now this one from Miami. Now, all of these initial surveys have had various controversies swirling around them for various reasons. There was even more controversy around the California tests, as a BuzzFeed article suggested that the Stanford professor's wife recruited people to that study on Facebook using dubious claims. However, this Florida study used data from electrical utility Florida Power and Light to generate phone numbers in targeted demographic areas, so hopefully it is close to a more representative body of individuals tested. But again, we just need data at this point, and the more antibody studies we get, the closer we can get to estimating true infection numbers with all the related extrapolations we can make in terms of true fatality percentages. This remains true even if studies are somewhat inaccurate around the margins. So I want to use the studies we have, imperfect as they might be, to try to hazard a guess at something. As journalist Josh Marshall pointed out, quote, the finding of 165,000 residents is roughly 15 times higher than the Miami-Dade's official number of lab-confirmed cases. The study released by New York State yesterday pointed to roughly 12 times the number of infections in New York City as official lab-confirmed numbers. End quote. And that lines up with the California tests, actually. So let's be conservative and put the number at 10 times. So for right now, a rule of thumb in the US might be wherever you see an official infection number reported, multiply that by 10. And that is maybe what the true number of positive cases is in a given population. And that actually lines up with what epidemiologists and public health experts have been predicting all along. Somewhere in the 10 times to 12 times range. So New York has 288,000 cases. By rule of thumb, we could cautiously estimate that the real number is 2.8 million. Illinois at 41,000, probably 400,000 is closer to the real number. The way we could have more confidence in that rule of thumb is by looking at the testing numbers. The more tests a state has done, the more likely that 10 times number is to be close to accurate. New York has done 39,000 tests per million people, while Illinois has done less than half that, 15,000 tests per million residents. So even if you multiply the Illinois number by 10, it could still be low. So we, like everybody else, have been talking a lot recently about what reopening society might look like, when it might happen, how we could do it. While some places like Italy and Germany experiment with reopening, others have extended their lockdown measures, leaving a lot of people to wonder what summer will look like in a locked down or at least socially distanced world. Last week, we discussed a study concerning a restaurant in Guangzhou in which researchers believe the air conditioner was responsible for the spread of COVID-19 from one infected diner to 9 others. In particular, several who were seated far from the infected person but directly by a vent. Writer Derek Thompson compared this study to another one of a call center in South Korea in which 94 of 97 workers who tested positive in the study all worked together on the 11th floor. Quoting the study, outbreaks of COVID-19 related to mass gathering, religious activities, workplaces, and hospitals have accounted for the largest portion of cases in the national outbreak. Both of these studies are early release articles to be published in upcoming issues of the CDC's journal. In comparing the two, Thompson tweeted, quote, "Some plausible implications if these findings are true. 1, it's probably safe to open the parks. 2, packed restaurants and bars are going to be verboten for a while. 3, meetings in small conference rooms were always deadly, but now they can literally kill you." End quote. A New York Times opinion piece this weekend also recommended the measured opening of parks and possibly even beaches as a means of both promoting good health and avoiding accidents that may occur if too much is restricted. For example, increased drownings if people still go to the beach but lifeguards aren't on duty, or the disruption to firefighters' work and the strain on water pressure caused by too many people opening up fire hydrants. The Times argues that people will be looking for ways to keep cool and enjoy some of their usual activities this summer, so both individuals and governments will need to get creative. Some recommendations from the Times: limit beaches to a fraction of their usual density, require masks, and consider closing on windier days when infected aerosol droplets can travel more easily. Reassign out-of-work parks employees from closed indoor recreation spaces to provide extra monitoring at beaches. Granted, they're provided with personal protective equipment. Limit two-way hiking trails to one-way and open golf courses to runners and walkers, both of which have been done in some cities around the country. Close streets to vehicular traffic and repurpose them for walking, running, outdoor dining, or even outdoor concerts that can be attended from stoops and balconies. As we mentioned on Friday, some towns are already converting drive-in theaters to host church services, graduations, and other community events. And as non-essential businesses are allowed to reopen, places like bars and clubs are envisioning how they might operate while social distancing, including restricting capacity, tasking employees with enforcing distancing, and, as Brooklyn dance party organization Daybreak has recommended, having staff greet visitors with compliments instead of their usual hugs. And architecture firms are looking at how they could redesign sports stadiums to accommodate social distancing. A popular idea is removing seats to have groups of 4 together with 6 feet of distance on all sides between the next group of 4 seats, similar to how some VIP seating is currently designed. The only issue for stadiums and all businesses used to packing as many patrons in as possible will be revenue. Quoting CNBC, capacity estimations came in around 17 to 20% of what stadiums are built to hold. Sports arenas are built for full capacity, taking in enough revenue to offset the debt of operations, including paying staff. Owners will need to decide if it's best to operate large facilities or if such capacity limitations are worth the losses. End quote. As the New York Times points out, our favorite summer pastimes will not look the same this summer, but with a bit of creativity, they don't have to be abandoned altogether. That is all for today. As always, this show was produced by Ride Home Media. You can pitch us stories on our Facebook at facebook.com/coronavirus morning report or on our subreddit at reddit.com/r/coronavirus pod. Talk to you tomorrow. Be well.